Hi, this is Dr. Vivek Sasindran and welcome to yet another episode of ENT Talks. So in the last few episodes, we have been touching upon certain common doubts regarding cochlear implantation. The next frequently asked question is, do we have to wear this device lifelong? Well, the answer to that is yes. Now you need to understand that once the device is switched off or if the device is removed, you obviously would not be able to hear. So these devices literally have to be worn all throughout the day and could be kept aside during sleep or when the child has a shower. Now the other question is, do we need to change this device frequently? Well, what you need to understand is the fact that technology keeps changing day by day. It's the same thing with TVs, your mobile phones, you talk about your cars, you talk about any gadgets, you have a different model coming out every year. The same way, these devices keep changing throughout as time progresses. So the implants that we have now are not the ones, or it's not the same technology that we had 15 years back. Now you probably would require upgrades. So if a child is implanted by 1 year of age, probably during his or her lifetime, you would probably require 2 to 3 upgrades. Upgrades in the sense, as technology advances, if the child wishes to have a newer generation implant, obviously you can go for an upgrade. Or sometimes, if the implant is damaged, if there is a physical damage to the internal component, that has to be replaced. So you obviously have the provisions for these. Thank you.